So what are the most common causes for infertility?
I want to convey the message that male infertility is equally on the rise. Lifestyle, recreational drugs, alcohol, nicotine.
Is it really hard to conceive after 30 or 35?
Age is the most important factor when fertility is concerned, especially for females. In our day-to-day OPD clinic, 1 in 3 woman has PCOS.
Your health, your story. Let's make it extraordinary. Hi, I'm Dr. Manasa Reddy. Today we have Dr. Aishwarya Garu, gynecologist and fertility expert with us. Let's welcome her. Hello, ma'am.
Thank you for having me here. Hello.
It's a pleasure, ma'am. How are you, ma'am?
I'm good. How are you?
I'm good. Thank you so much. So today, common issue is infertility. Most of them are facing infertility issues.
Yes.
So today we'll deal with that, ma'am. So what are the most common causes for infertility?
Earlier, we used to blame just the female for infertility, but let me tell you, the contribution of the factors for fertility not happening from male and female, now it's equal 50 and 50. By saying that, I want to convey the message that male infertility is equally on the rise. So most common causes, if we take the female, it would be the eggs not of good quantity and quality. The tubes could be blocked. The uterus might have abnormalities which are right from birth like septum, biconjugate uterus, or it could be acquired like fibroid, polyp, adenomyosis. 2 major concerns in today's times would be endometriosis and PCOS, which lead to hormonal imbalance and also affect the ovarian reserve. The advancing maternal age, women are choosing to have childbearing at later age. That is also one of the major reasons. Coming to the men, it's lifestyle, recreational drugs, alcohol, nicotine. So all this will affect not just the sperm quantity, the motility and the shape. It also causes erectile dysfunctions because of the overall metabolic dysfunctions which happens due to the deranged lifestyle. So these could be one of the major reasons, and then there are infections and other systemic diseases which can also lead to infertility.
So ma'am, what do you suggest? What is the best time to plan for the pregnancy?
So each woman will have her own cycle length. Depending on her cycle length, in a regular menstruating female of 28 to 30 days cycle, they can try between 10 days to 18th day of the cycle. Why? Because the egg survives for 12 to 24 hours in the reproductive tract, while the sperm survives up to 72 hours. So 5 days leading up to ovulation and 1 day later, they can try on alternate days. But the women having shorter cycles, they will have to start planning earlier in the cycle because they will ovulate earlier. So it all depends on the female's menstrual cycle length.
So ma'am, what is PCOS and does it really affect the fertility count and all?
So PCOS is the most common endocrinological disorder in the reproductive aged women. Its incidence is 6 to 13%. In our day-to-day OPD clinic, 1 in 3 woman has PCOS. It has become rampant. It is a hormonal disorder wherein she has excessive of male hormones, which can lead to irregular menstrual cycles, which can lead to excessive unwanted hair growth, and there are some ultrasound changes also in the ovaries. We see large number of follicles, polycystic ovaries. So how does it affect fertility? It can affect the ovulation, the egg growth, the egg release. It can also affect the endometrium, the implantation, and many often we see PCOS is associated with obesity, which can also cause other hormonal problems like deranged thyroid levels, prolactin levels, which also indirectly affects the fertility. And also once she becomes pregnant, she can have complications like gestational diabetes, gestational hypertension. So PCOS is a metabolic disease which affects her fertility and also her long-term health.
So ma'am, what are the symptoms of low sperm count in men?
Low sperm count will not have any symptom in particular. The most common presentation would be infertility. And during evaluation for infertility, by chance, when we do the semen analysis, we get to know that he has low sperm count. But if this low sperm count is due to some systemic diseases like high blood sugar levels or due to some infection in the testis or prostate, that can cause testicular pain, or it can also lead to erectile dysfunction if the sugars are high. But in general, low sperm count in particular will not have any symptoms.
Can irregular periods cause infertility?
Your periods tell a lot about your reproductive health. Irregular periods can happen due to PCOS, can happen due to thyroid disorders, can happen due to raised prolactin levels, or even stress. So if your periods are irregular, you will not ovulate every month. So even if the couple is trying, they will not be able to conceive. And it's also difficult to tell them when to try because the cycles are not regular. So irregular periods could also be due to premature ovarian insufficiency. Because in today's times, we see young girls having very low reserve. So they are also heading towards premature menopause. In those cases also, she can have irregular periods or early periods. So irregular periods, we need to do a complete hormonal evaluation and know why it's happening, correct it. And if it's just PCOS, we can definitely help her with just follicular induction and she can conceive.
Does really endometriosis cause problems in conceiving?
Yes, definitely. Endometriosis is a chronic inflammatory state. It affects the ovaries, the fallopian tubes, and the uterus. Presence of chocolate cysts in the ovary can cause compression, decrease the blood supply, and it can lead to decrease in ovarian reserve, not just in quantity but also quality. The fallopian tubes get affected. So the egg pickup from the ovaries also gets affected. The sperm transport gets affected in the fallopian tube, and it also affects the endometrium and hence implantation. And it can also lead to distorted complete pelvic anatomy in prolonged cases of endometriosis. So 30 to 50% of patients of endometriosis present to us with infertility.
Because of that reason?
Yes, because it is affecting each organ of the female reproductive tract, causing inflammation, release of chemicals, cytokines, which can affect implantation.
Okay. Most of them know egg freezing, but what is social egg freezing?
So any egg freezing done for non-medical conditions, like the females are becoming more financially independent, they want to pursue their career, they want to delay childbearing. So they want this freedom to achieve their goals, their dreams before they start a family. So they have this option now. They can freeze their eggs for up to 10 years. But many of them, they come to us around the age of 37, 38. That is too late because the female's fertility declines at 30 and at 35 there's a sharp decline. So we would definitely want them to come to us around 30 and if not then at least before 35 so that we can preserve more numbers and better quality. And then she can plan to have a family later on, once her goals are achieved, her financial freedom is achieved, or maybe in some cases they're not sure of their partners. So this is social egg freezing.
So ma'am, what are the other medical conditions for egg freezing?
So cancer is on the rise, unfortunately. Both men and women have increased incidence of cancer now. So our strong message would be whenever they are diagnosed with any form of cancer, after consultation with their oncologist, they can come to us for one round of counseling. Depending on the type of cancer, the grade, and how many days we have in hand before they start their therapy. For females, we would need around 10 to 12 days. We need to give them injections for the eggs to grow. And then under small anesthesia, we retrieve the eggs. If they have a partner, we can form embryos also and we can freeze. For men, they can give samples and some 2 to 3 samples can be frozen. So whether they want to do it or not, at least they should be offered because later on after chemotherapy and radiotherapy, there will be definitely damage to the reproductive organs, the sperms and the eggs. So later, even if they wish to have a child, it's very difficult. So before they start their therapies, they should be sent to a fertility specialist for a counseling. And if they are okay, we can go ahead and freeze either eggs, sperms or embryos.
Is IVF more successful than IUI?
Depending on the indication for that couple, IVF cannot be blanket. The treatment has to be tailored according to the need of the couple. At what age they are, how many years of married life, what is the present status of their sperms and eggs, the fallopian tubes, the uterus. In IUI, the procedure is we inseminate processed semen sample inside the woman's uterus.
Okay.
So the chances would be around 15 to 20%.
Hmm.
But in IVF, we retrieve the eggs, we fertilize it with the sperms, we form embryos.
Okay.
So we have bypassed a lot of steps, and morphologically good-looking embryos are transferred into the uterus. So the chances would definitely be up to 40 to 50%.
Okay.
So IVF definitely has better chances than IUI. Yes.
So what are the chances of twins in IVF?
Chances of twins in IVF are definitely higher than natural pregnancies. The reason being, many a times more number of embryos are transferred into the uterus, and especially for young females whose egg quality is good, the implantation would be higher.
Okay.
And twin pregnancy is a high risk pregnancy. So we as clinicians, we need to be more responsible and transfer less number of embryos. And now the concept of single embryo transfer, SET, is being practiced, especially if we have tested the embryo for any genetic abnormality. So euploid embryo means a genetically normal embryo. Only single embryo can be transferred, and we can reduce the incidence of twins in pregnancies.
Does birth control pills affect fertility?
No, not at all. The birth control pills, they affect the hypothalamus pituitary from the brain, which releases hormones to produce eggs. So as long as we use the pill, that system gets suppressed. When we stop the pills, within few months, most of the women, they resume their previous menstrual pattern and they can conceive. So if after stoppage of the pills within 6 months to 1 year, still they are not able to conceive, then they should seek consultation. But temporary usage of birth control pills definitely does not affect fertility. It resumes all the reproductive functions, they resume after stoppage of the pills.
Is it really hard to conceive after 30 or 35?
Age is the most important factor when fertility is concerned, especially for females. So after 30, it declines. After 35, there's a sharp decline in the ovarian reserve. So, and even the fallopian tubes, they can get infected, and there could be fluid accumulated in the tubes, which is called hydrosalpinx. The uterus, as the woman ages, it can have fibroid, it can have adenomyosis, there could be endometriosis. So, as we age, definitely it becomes difficult for the woman to conceive, and not just for women, even for men after 40, 45, even their semen parameters in terms of count, motility, and shape get affected. So earlier, the better.
Why does egg quality decline with age in women?
So egg quality declines with age in women. We all know that. Why? Because of chromosomal abnormality, the aneuploidies. So as she ages, she will have less chances of conceiving. She'll have more miscarriages because these eggs have chromosomal abnormality. And also, the offspring can have more chances of genetic diseases.
What is an AMH test and why is it important in fertility?
AMH is anti-Mullerian hormone. It helps us to know how many eggs are left in her ovaries at that point in time. And also, AMH helps us to predict her response to fertility treatment. This helps the clinician to form a tailored treatment plan for each woman. High AMH will be seen in PCOS patients, low AMH in advanced maternal age who have diminished ovarian reserve, and also in young women with premature ovarian insufficiency. So the AMH levels also to some extent help a woman to know how much time she has in hand before she can plan for the family.
Is this test only for women?
Yes, it's only for women and for her ovarian reserve. And it only tells the quantity that she has. It cannot tell us about the quality of eggs that are present.
Okay. Which foods should be avoided while trying to conceive?
Not in general for fertility. Any food which affects your overall health, like packaged food, red meat, processed meat, sugary drinks, high salt content food, deep fried food. So all these need to be avoided. It will help you maintain your overall health and improve your fertility.
Does smoking, drugs, and alcohol affect fertility rate in men and women?
Nicotine, alcohol, recreational drugs, they affect fertility both in men and women. In women, they can decrease the ovarian reserve, They can affect the implantation by having a negative effect on the endometrium. In men, it can cause decrease in sperm count, the motility, increased DNA damage in the sperm, and also can cause erectile dysfunction.
Does laptop heat or radiation affect the sperm quality in men?
Yes, keeping the laptop in the lab for a long time can cause heat radiation, which can increase the scrotal temperature and lead to decreased sperm quantity, increased DNA damage in the sperm. So they should keep the laptop on a desk and they should take frequent breaks. They should keep cooling pad and not cross their legs to keep the circulation maintained while using laptop for a long time.
Okay. So, ma'am, would you like to give any message for our viewers?
Yes, a strong message would be don't fear the first fertility consultation because delaying the first consultation can land you up in IVF, which would not have been required had you taken the first consultation on time.
Okay.
So don't fear that the very first consultation you will be advised IVF or any treatments. Many of them will conceive with some subtle assistance. So take the first consultation on time for couples less than 30 years after 1 year of trying, and for those who are 35 and above after 6 months of trying, and those who already have a known factor, they should consult immediately.
So, thank you so much, ma'am.
Thank you. Pleasure was all mine.